Assalamualaikum. If you're wondering what is a dental public health specialist unit, it is actually a preventive dental clinic led by dental public health specialists. It was established by the oral health program in 2019 due to the increase in the number of preventive visits and the prevalence of adult caries based on the findings in NOSA 2010. Basically, the dental public health specialist role in Malaysia is mainly responsible on the management and administrative aspect. However, Rosio and his friend described that the DPH specialist's role is more than that. It is actually a science and art that prevent and control diseases and at the same time promote better oral health in the community. The quote from Rosio actually matching with the function of this unit, as this unit actually conduct clinical prevention, behavioral modification, health promotional and also tobacco cessation program. It also looks into patient identified as high risk and is unable to be managed by the primary dental clinic or other specialty. It functions as a complement to the needs of other specialty by focusing on the preventive and rehabilitative care to their patients. The objective of this study is to explore the perceptions of dental personnel managing and referring cases to DPHSU. As you know, it is a new facility and there has been no study done to assess its existence. Hence, the findings from this study I hope can be used to improve the management of the unit and at the same time planning on more units in other locations. This research is a qualitative study where data were collected through interviews. Interviews were conducted on 11 dental personnel who had experience managing patients in the DPHSU, and 8 dental personnel with experience of referring cases to the unit. The questions asked during the interviews were semi-structured validated questions. The interviews were conducted according to the participants' preferences and were recorded digitally. The interview sessions were conducted until saturation was achieved. After that, the recordings were transcribed verbatim and analyzed thematically with in vivo software. The dental personnel identified with experience of referring cases to the PHSU were working in the primary dental clinic and non-hospital-based specialist clinic like periodontic, orthodontic, and restorative dentistry. The type of patients referred were mainly patients who need to stop smoking and patients with poor oral hygiene. The dental personnel admit that they will only refer when the patient is interested to change their bad habit. Specialists describe that instead of focusing their time on the treatment they are specialized on, they are spending too much time in habit management. Hence, referring behavioral management cases save their appointment slot a lot. Interestingly, a clinician admitted to being not excellent in doing tobacco cessations, hence referring to this unit is the best action. From the interviews conducted to the managers of the PHSU, it is also noted that tobacco cessation was the management frequently mentioned by the managers of the unit. The things that make a difference in the management of quit smoking cases in this unit compared to the primary care setting is that they are able to use pharmacological therapy to assist their patients, and most of the dental personnel are certified to conduct quit smoking cessation in the unit. Despite this, the managers feel that it would be better if they were trained in the behavioral management courses. As a new facility, this unit also faced understaffing problems, and most of them mentioned that adding more supporting staff and placing a permanent dental public health specialist in the unit could add more values to the unit. The DPH specialist managing cases suggested that improving the DPH specialist training during postgraduate could give some benefit to the unit. Other barriers discussed include lack of referral, especially from the primary dental care, and low attendance. The managers described patients' low awareness on preventive dentistry lead to low attendance. Some of the dental personnel who work there based on rotation also feels bad that they can't be following up on the same cases due to the rotation. Positive impacts were seen on patients referred to the PHSU. The clinician mentioned that they can see improvement in the patient's oral health conditions. Patients were more motivated and had positive attitude on oral health and dental treatment. As a conclusion, despite the barriers and challenges encountered by the PHSU, positive impacts can be seen in the patients. Overcoming the problem could improve the unit's management of patients and thus help reduce future disease burden among the population. Last but not least, I'm Nurul Fahizha binti Fahimi from Faculty of Dentistry UiTM Sungai Buloh. Thank you for listening.